Good day everyone, my name is Charles Bolaños. Today we were talking about um, regarding HIV or AIDS screening and testing, signs and symptoms and prognosis. So first, HIV testing, also called HIV screening, is the only way to know if you have the virus. Several types of tests checks your blood or other body fluids to see whether you're infected. Most can spot HIV right away because it takes time for your body to make antibodies or for enough of the virus to grow inside you. So this is the way you can have a HIV if you have had several sexual partners or had unprotected sex with someone who is or could be HIV positive, including someone whose sexual history you don't know if they are injected drugs with a needle, syringe or other device that someone else used first, or have had or are getting tested for tuberculosis, hepatitis or any sexual transmitted disease, including syphilis, gonorrhea, chlamydia or herpes, or if you have had sex for drugs or money, or had sex with someone who has a history of any of this disease. So this is the way to test or to check if you have an HIV. This test checks for protein that your body makes within 2 to 8 weeks of an HIV infection. They are also called immunoassay or ELISA tests. They're generally very accurate. Rapid version of this blood and oral fluid tests can give result in 30 minutes or less, but they may give negative result even when you're infected. This is called a false negative. Nucleic acid test or NAT. This is also known as an RNA test. It looks for the virus itself and can diagnose HIV about 10 days or after you've been exposed. It's expensive, so it's usually not the first choice. But if you're at high risk and you have flu-like symptoms, your doctor may want to use it. HIV tests are very accurate, but no test can detect the virus immediately after infection. How soon a test can detect HIV? It depends on the type of the test being used. There are 3 types of HIV test. First is the antibody test of HIV test, antigen antibody test, and the nucleic acid test. So that's all for today. Thank you.